often do you find yourself thinking about how a pregnancy works? How a sperm meets an egg, meets the uterus, and if everything goes well, over 9 months' time, you're going to go, out comes a baby, out comes the placenta, and you go home with a healthy newborn baby. At least, that's what happens about 70% of the time. I'm a scientist studying pregnancy and disease, and I often think about how pregnancy doesn't always work as planned. I think about how up to 20% of pregnancies are lost in the first few weeks, and how up to 10% are born too early, a condition called preterm birth, a worldwide health concern, and the leading cause of death in children under the age of 5 years old. And what's most devastating to me is that we don't know the cause. We have no explanation to offer families left wondering why their pregnancies ended the way they did and if there's anything they can do in preparation for the next one. But recent scientific advances have given us a clue. We think the answer may lie in a special immune cell called decidual natural killer cells, and these are found only at the interface of mom and baby. But everything we know about this cell type and disease come from pregnancies after they've ended, after the disease has already done its damage. But we do actually know how these cells act and look in early pregnancy. But this information comes from elective terminations, where we'll never know if this pregnancy was going to become healthy or not. If we want to be able to predict, slow down, or even stop disease from developing in pregnancies, we need another scientific advance. What we need is a model that's going to allow us to look at early pregnancy immune cells while also knowing if they're going to develop disease or not. And this is the model I've been developing over the past 5 years. I figured out a way to make these early pregnancy immune cells from stem cells, and they look and act just like those in early pregnancy. And we've been collecting these stem cells from patients with and without pregnancy complications. So now I'm really excited for this next phase of my research, where I'm going to be making these early pregnancy immune cells from patients who have gone on to have complications or not, to see what's different, finally giving us clues on how we might be able to stop this disease from developing. It is my hope that the next time a family comes looking for answers, I'll be able to give them one. Thank you.